Minister Dr. Mkhize is, of course, in the Eastern Cape assessing healthcare in the province. Let's take you live then to that briefing.
Then we also wanted to discuss the issues in relation to the health crisis. This has been the report that's come through with concerns that are coming from the media, from some of the members of the public. Effectively, the challenges of the Eastern Cape are not new. There are issues that relate to a number of aspects. One, there is a challenge of the funding in the whole province, and we've gone through quite a bit of detail on that. There's also the issue of human resources. There's also issues of weaknesses in leadership, in management leadership, and there are also serious issues that relate to the infrastructure. And as a result, then you're finding a lot of gaps. In the process of discussing, it is clear that in general, health services are underfunded. They do need quite a lot of increase on the funding, based on the fact that there's a whole shift in the demography of diseases, with a lot more of non-communicable diseases that are causing a lot of pressure, requiring more specialized services. On the other hand, the population numbers have increased to the extent that there are hospitals which are overrun by the population sizes. So to rehabilitate the pre-existing facilities, as well as provide new additional facilities, has been one of the challenges. So those are some of the things as we go through infrastructure that we're discussing. Then in addition, part of what we have seen as a challenge has been the loss of funds due to the medical claims. This is something that we have accepted, that we have to work together as national government and the provinces. In the first instance, there's quite a lot of work that's been done to coordinate the government response on medical issues, so that we are able to identify where the real weaknesses are. The approach of the various legal firms that we're finding that are involved in various provinces working on the common claims is something that we have to address. And also the loss of cards, which we think is really not just loss, but we think some of it is deliberate. We need to address that. And so in the short term, there's an aspect that we have to give attention to. In the long term, I think those will be assisted by the digitization of health information, patient information records in the future, so that we are always able to find the records whenever we need them, and there's no need for someone to lose a case as a result of that. But we also have to work together, because as I was talking about the no-fault compensation fund, I am convinced that we need an approach that is more or less the same to deal with medical legal claims, so that anyone who suffers any adverse injuries whilst attending health services should be able to go and claim without needing to go through a lawyer, and they must be able to get compensation that is appropriate for the kind of injury or harm that they would have suffered. But we also need to ensure that we cap the levels of claims, so that you don't end up with one person who's going to put up a claim for several millions, which is really not based on a realistic cost, but they begin to postulate on future costs on something that already government is offering the services about. So there's a whole lot of work that we're doing in that regard. Then I was encouraged to see that the province has embarked on a whole turnaround strategy, which they call the service optimization plan, and I've encouraged the MEC to make sure that there's a whole new thinking that goes in to reimagine a different approach to the culture of offering the health services in the province, and making sure that it must begin to take into account the new human resource requirements which we've got in our new human resource strategy, because the there's a huge amount of increase in the number of specialists who can offer services now in various districts, which require a lot more investment. So we need to start thinking about that as we move into the future. So that service optimization plan is something that I also like to get closer to, so that we can influence and help to strengthen it, so that we can see a turnaround in the province of Eastern Cape. The MEC has raised the question of additional support to the office of the head of department. You will recall that what actually initially had happened, Dr. Zungu had been brought in to actually help on the response to COVID-19. In the process, when the previous head of department retired, she was then actually seconded to do that work. So there's additional support that she needs, and she's going to be sending us details of that in a written correspondence, and we'll also have a discussion between myself, the MEC, and the Premier to look at what else we can do to support the province. Then the other issues relate to the human resource issues. Now, because of the financial constraint, you can see that sometimes there's a temptation to use the freezing of posts as a way of, cost containment. We've discussed this issue, and we have now said that the MEC must work together with the head of department to make sure that the current post, if there's any form of resignations or departure from service, that those should actually be allowed to be filled without any interruption, without any delay. So they're going to be dealing with that issue to make sure that we don't further lose staff which can't be filled immediately. Secondly, we have also indicated that they need to ensure that the delegations for human resource issues must actually reside at the level of the institutions and the districts, so that it does not take many months to fill up a post if somebody walks away from service right now. So we have said we're going to work together to make sure that we reach that. We have also said that in terms of the vacancies, there's a targeted number of about, first let me start talking about the acting positions, that they need to deal with the closure of the acting positions, and we've given them a target that by the end of May, between May and June, they should be able to deal with about 40% of these vacancies, so that the decision-making processes are in place and people can actually be able to exercise authority as they take various decisions. Then we have to deal with the issue of the vacancies which are unfunded and yet necessary. Now that issue is something that needs a huge amount of discussion, because it basically talks to the baseline. It talks to the fact that currently there's been a whole reprioritization that is going on. There's been a reduction in the baseline if you look at the different provinces, and therefore this is an issue that we're now feeling the pinch. And on that basis, we're going to have to discuss it at a higher level to see what is it that can be done to assist in the situation of the Eastern Cape. But I've also then said to the MEC, and I was also quite pleased to see that the MEC, new as she is actually on top of her game in understanding what the issues are and what interventions are needed, and that's very encouraging. But then we've then said, having been here the most of last year and so on, dealing with the issues of COVID-19, we must now focus on this crisis in the Eastern Cape and see how we can resolve. So certain basics need to be dealt with. So for example, we need firmness in the leadership. Leadership that is able to ensure consequence management, leadership that's going to deal with issues of fraud and corruption, a leadership that's going to be able to ensure that there's efficiency in the system, deal with incompetence. All those issues are going to be very, very important to actually make the system to be ready for any changes or transformation that we're going to require. So I'm going to be working very closely with the MEC and the Premier just to make sure we give the necessary support in this regard. And so that's been the nature of our conversation today. It's been open, it's been frank, and I think all of us have been able to look at each other to say, well, we all have a common responsibility to deliver the best quality health services for the people of South Africa. And from that point of view, each and every one of us must do our best to make sure that people rise to the occasion and make themselves available for fulfilling the particular responsibilities that running the health services require. I have also been very encouraged with the reports of a lot of changes that are happening. The partners who have come in to help to support to improve the infrastructure in some of the areas. And so in Doranginza, we were taken through the maternity unit where the Clinton Health Initiative has been able to finance the refurbishment of various areas. We've seen how that has improved the morale of the various members of staff. We've got the report of Sir Henry Elliott, where last year I went through, they were still doing renovation, but the morale of the staff that has been improved, and how everyone up there has gone up to embrace the whole program of vaccination, of the refurbishment of the hospital, and shown a lot of positive energy has also been quite impressive. So there's quite a lot of good work that is being done in the province. There are also challenges. We have been receiving from the media a number of very negative issues where you see people who are not well taken care of,